Hello, this is Dr. Pelto, and welcome back to Healthy Living. As many students go back to school, there's one condition I want to talk about that's common to those that participate in ballet. This condition is called Os Trigonum Syndrome. Let's start by looking at what is an os trigonum. An os trigonum is an extra bone that's called an accessory bone that's sometimes developed behind the ankle, specifically behind a bone called the talus. It's connected to the talus by a fibrous band of tissue that's kind of like a rubber band. And the presence of an os trigonum in one or both feet is something that you're born with. It's present at birth, but it becomes evident later on, especially when you're in adolescence, because the area of the talus does not fully fuse or become a mature bone until that time. And there's usually another little extra bone here that can become painful. Now, only a small number of people have this extra bone. So what is this Os Trigonum Syndrome? Often people do not know when they have an os trigonum or this little extra bone unless you have an x-ray. And it usually doesn't cause any problems. But there are some people that have this extra bone and it becomes painful. And that's when it becomes painful, they call it the Os Trigonum Syndrome. So this syndrome is usually triggered by an injury, such as an ankle sprain or going on your toes. So if you see here, if I go up onto the toes, you can have this action right here where it can actually injure that little bone that's in the back of the ankle region by this repetitive up and down motion that happens, like pointing the toes, which is common for ballet dancers, but also for soccer players and other athletes. For the person who has an os trigonum, pointing the toes downward can result in a nutcracker injury. Like an almond in a nutcracker, this is an os trigonum where it crunches the ankle and the heel bones as the os trigonum pulls off that loose little piece of connective tissue that's attached and stretched and torn in that area and becomes inflamed. What would you feel if you had an os trigonum syndrome? The symptoms and signs of an os trigonum may include the following: deep aching pain in the back of the ankle, especially when you're pushing off with your big toe or when you're pointing your toes downward. You could have tenderness to the area of the back of the ankle when it's touched. You can have swelling to the back of the ankle as well. And how's the diagnosis made? Usually an os trigonum can look like other things, like an Achilles tendon injury or an ankle sprain or even a broken bone. So the best way to diagnose this is by looking at some detailed questions and being evaluated by a doctor. Most importantly, getting an x-ray or other types of images like a CAT scan or an MRI can help you make the diagnosis. So what are some of the non-surgical treatments to get relief from this problem? Usually this can be relieved through a combination of the following items. Rest. It's important to stay off the injured foot and let the inflammation subside. You can use a walking boot to immobilize your foot. What that does is it restricts the ankle and the motion in that area to allow it to rest and to heal. You can also use ice. Ice is a very good natural anti-inflammatory. You can put that behind the ankle with a towel to the affected area. I wouldn't advise putting ice directly to the skin as it can cause kind of a cold burn to your skin. You can take anti-inflammatory medications like Motrin and ibuprofen. This can be helpful in reducing the pain and the inflammation in that area. And then sometimes you can do a cortisone injection in that area. What you do is you find the area where it hurts the most behind the talus, and you can inject a little cortisone in that region and rest the foot, and many times that can reduce the inflammation to make you feel better. So when is surgery needed, you may ask? Most patients' symptoms improve with non-surgical treatment. However, in some patients, surgery may be required to relieve the symptoms. Surgery typically involves removing that little piece of bone called the os trigonum that's really not necessary for your foot to function normally. If you'd like to learn more about this os trigonum problem, go to drpelto.com and you're going to find a link titled Healthy Living Information, and you can learn more there.